Hi, I want to start today's COVID-19 update with a trigger warning. It will include grim descriptions of death and disease. So if you're working through some mental health issues or have been feeling increasingly anxious or stressed with all the COVID-19 information coming your way, I suggest you skip this video. I will ensure that all essential facts are there on our Instagram grid for you to consume at your own pace. And you can always revisit this when you feel more in control. Let's begin with the basics. The second wave of COVID-19 in India has touched an unprecedented milestone. On April 14th, we reported 2,739 new cases in 24 hours. USA is the only other country to ever hit this mark within a span of one day. 1,038 people. I'll repeat that. 1,038 people breathed their last and passed away in one day on April 14th, succumbing to the deadly virus. We have now lost over 1.73 lakh Indians to this relentless disease. Strains of the COVID virus in India with double mutations have been found in patients in 10 states, including Maharashtra, Delhi, West Bengal, Gujarat, Karnataka, and Madhya Pradesh. For instance, the double mutant variant has been found in 61% of the samples tested in Maharashtra, establishing that it has now become dominant. That's up from 15 to 20% on March 24th. A double mutation is when two mutated strains of a virus come together to form a third strain. The one reported in India is the result of the E484Q strain, which is indigenous, and the L452R strain from California combining. The government continues to stop short of attributing the second wave to these new mutations, but has called it a variant of concern. You have to remember, all this is happening real time. So, as we suffer the wrath of this second wave, parallelly, scientists are rushing to study the role of the double mutation in COVID-linked deaths, the severity of infections, preliminary infections, reinfections, and its effect on vaccination. This is to say that it will be some time till we have conclusive evidence about whether or not the double mutation is more infectious or deadly. India's principal scientific advisor told Hindustan Times, as have many other experts, that vaccines are still likely to offer protection against the new variant, even though the effect of the shot may be less than normal. But it will still give you more protection than with no vaccine at all. So if you're eligible or your loved ones are, please get vaccinated. There is no other way to say it. Our healthcare infrastructure is overwhelmed to the point of breaking. In India's shiniest metropolitan cities, Delhi and Mumbai, hospitals are running out of beds, ICUs, medical oxygen, and even crematorium and graveyard spaces for the dead. I urge you to imagine places with worse healthcare infrastructure. In Mumbai, private hospitals have begun using 5-star hotels to admit patients with mild COVID-19. Delhi has attached banquet halls, schools, and sport complexes to hospitals to increase the number of beds. Local media has been filled with grim reports of melting furnaces at crematoriums running non-stop, bodies piling up, and smoke from continuously burning flesh, creating health risks for locals. Workers at crematoriums across the country confirmed to Live Mint the scenes, saying that they have seen COVID-19 deaths climbing very tangibly. In Delhi's biggest crematorium, the Nigambodh Ghat, bereaved families are being made to wait for hours despite 22 platforms and 6 CNG furnaces running round the clock. In Beed in Maharashtra, India's worst hit state by far, there were reports of as many as 8 people being cremated on one funeral pyre. In Mumbai's Nalasopara, 10 people died in one day in 2 private hospitals due to a lack of medical oxygen, after which hospitals in Vasai and Virar have begun turning away critically ill patients. Videos, news reports and interviews from Lucknow in UP and Surat in Gujarat will shock you. Dozens of bodies being burnt on open grounds, with anecdotal evidence suggesting people are waiting for 8 to 9 hours with their dead, forced to cremate their loved ones on firewood beds, often using petrol or diesel for the funeral pyre, often after sunset. Queues in Lucknow for Covid-19 tests and for Remdesivir in Gujarat are so long and so packed, with desperate people failing to follow social distancing. The crematorium staff in Lucknow told the Telegraph that based on their conversations with family members, most of the dead were COVID patients who had died in hospitals or while waiting for beds. From Gujarat, we have visuals of a long queue of ambulances carrying COVID patients outside a civil hospital in Ahmedabad for over a week now. This is Ahmedabad, the largest city in Gujarat, and we're seeing videos of the dead being carried to cremation grounds on garbage trucks because they're running out of mortuary vans. Similar reports are coming out of Chhattisgarh. A viral video from Raipur in Chhattisgarh, one of the top 5 worst hit states, shows dozens of dead in body bags on the road, in hospital waiting areas, in corridors. Bodies are also piling up in Madhya Pradesh's crematoriums, with locals telling NDTV that they haven't seen such scenes of death since the 1984 Bhopal gas tragedy. At the same time, local media in UP, Gujarat and Madhya Pradesh have alleged very strongly that the state is obfuscating the actual number of deaths. Experts agree, even before the virus struck, they believe that only between 20 to 30% of all deaths in India are properly medically certified and thus reported. Bihar is also struggling once again due to the surge in cases and the renewed influx of thousands of migrants from states like Maharashtra and Delhi. Indian Express reports that COVID-19 beds at about 20 government and private hospitals in Bihar are already full. UP has also released guidelines for incoming migrants, thousands of whom have been lining up in Mumbai's railway stations, fearing another lockdown. Several states have imposed either a strict curfew or a night curfew or a complete lockdown in worst hit districts. But, and it must be said, election rallies in 5 poll-bound states, especially West Bengal, continue against all expert opinion and medical advice. No less than the Prime Minister and the Home Minister of the country are addressing thousands of unmasked people stuffed together like sardines. TMC's Mamata Banerjee is also holding rallies, all while ironically blaming the BJP for bringing the disease to the state. And the Kumbh Mela in Haridwar continues. There were fleeting reports that it may be called off prematurely because to keep it going is dangerous. But officials have dismissed these reports. The final word is the show must go on. And so just yesterday, over 14 lakh pilgrims congregated together to take a dip in the Ganga. No masks, which was clear from the visuals, and of course, no gaj ki duri. And so over 1700 people have tested positive at the Kumbh in the last 3 days, including Samajwadi Party chief Akhilesh Yadav, who visited the Kumbh, and Akhara Parishad chairman Mahant Narendra Giri. I'll note here that there are no rules or protocols for managing these pilgrims once they return to their towns, cities and villages across India. I'll stop here for today, but not before saying that we are here because of a mixture of hubris, complacence, negligence, data denial and a lack of clear public health strategy. Now more than ever, it's up to us to break the chain at our individual levels as much as we can. So stay at home. If you go out, know the risk that you're taking and maintain distance. Wear a mask, wash your hands, don't touch your face. It's getting really bad out there, and anyone who thinks otherwise doesn't have the facts. So please share this video on your feeds with your friends and your family. If you've been listening, thank you so much for your time.